Hello, this is the extended cut of the video we made on COVID-19, and you can find the original in the upper right corner up there. Here we are going to be answering a few more questions from friends and family, and covering more information, such as how to practice social distancing properly.
Great.
So our first question is from my aunt. What is the process from hypothesis to shot in the arm of creating a vaccine?
So to create a vaccine, I guess we should start with the ultimate objective. You know what the ultimate goal of a vaccine is?
To prevent you from when you get the virus, makes it better?
That's close. That's really close. Yeah. So you get a vaccine, and then what that does is it basically serves as a decoy and tricks your body into thinking you really got the infection. So then your body does this whole immune response, which it then remembers, so that if and when you do get exposed to the real thing, your body's ready to fight it off right off the bat. So when people are creating a vaccine, the goal is to make sure that what gets put into the body looks enough like the infectious agent that it will trigger the immune system to make a reaction, so that then your body is protected when you really get the thing. Right?
Yeah.
Okay. So there's lots of things that go into getting that right.
Okay.
All right. Whenever people are working on trying to develop a vaccine, the first thing that's important to do is to understand, how does this thing actually get into cells? So we could draw a cell just like this. And how does it turn the cell into a factory that makes a whole lot more of these viruses? Because that's what viruses generally do. So we need to understand a lot of this. And then we also need to understand, how does the immune system come along? That's the part of the body that helps us get better when we get sick, and helps us protect us from getting sick the second time. So the immune response comes along and does something to block this from happening and keep us from getting sick. So in order to understand all this, there has to be quite a lot of laboratory research. This is also called basic science. It can be called preclinical. All these things essentially are about trying to understand all of these processes, so that we can really know what it is that this virus does to the body, and especially what it is that the immune system does to get rid of the virus and protect us. So all of that has to happen before we can develop a vaccine. So you would have cells that you put in these dishes, and then you add the virus or something that looks like the virus, and you study what happens.
Wouldn't you want to add in the actual virus?
It depends on what you're trying to understand.
How do they get the virus?
Well, you can grow it. So you get a little bit of virus, and then you put it in cells, and then the cells make a whole lot more.
Well, where do they get the little bit of virus from, though?
Well, it can be harvested from patients. And
sounds weird.
Yeah, that is a weird way of saying it.
Sounds like something that would be in Silence of the Lambs.
Oh, yeah. That's
Doesn't
a
it?
weird way of saying it.
Yeah.
Yeah, you're right. But you can get it from patient samples. Eventually, there can be other laboratories that synthesize these things and provide them. That's after we already understand a whole lot about the virus. So I would imagine that it's probably coming from patient samples, but that's a guess. I don't do this kind of laboratory work anymore, so I'm not sure. So this first early part of vaccine development is preclinical or basic science, basic vaccine research that happens in a laboratory. But then after that, there need to be actual trials to see, will this work? Is the vaccine safe? So after that, they develop what you might call a vaccine candidate. This thing that's in this bottle here, this is supposed to be a vial, and this is something that could potentially become a vaccine.
It's pretty good.
Does that look like a shot?
Yeah, it does.
Yeah.
If global health experts knew there was going to be a pandemic, for sure knew, but how come they weren't taking precautionary measures?
Well, okay, so I feel like that's actually two questions.
Oh.
Which is fine. Oh. But one question is sort of how come we didn't already know that this virus might be coming? Is that right?
Yeah.
Okay. And the second question is, how come we weren't taking precautions against it? Right?
Mm-hmm.
Okay. So there are two. Can I answer the second one first?
Yeah.
In terms of taking precautionary measures, this is part of what global health experts have been trying to do and trying to get governments to do for years now. Mm-hmm. So even if we don't know what the exact virus is. We do know that, for example, we're going to need personal protective equipment. We're going to need to have plans in place so that if something emerges, we can detect it quickly. We're going to need to have collaboration between different government organizations. Those are plans that you can make that are precautionary, even if you don't know exactly what the virus is going to be.
Going with vaccines.
Okay.
Got off track there.
Well, but I didn't answer your second question about how come we didn't know this virus was coming.
Yeah.
It turns out that RNA changes a lot.
Mm.
And there are some viruses that have 1 or 2 pieces of RNA in them, and some viruses that have a whole bunch of pieces of RNA in them. And those ones with a whole bunch of pieces can sometimes, if there are 2 of them that have different types of pieces, if they get in the same individual, it can generate a new version that has a mixture of all those pieces.
That's kind of crazy.
It's crazy, but it's also worrisome because that means that those viruses can generate a new virus. So what scientists have been talking about for a while is they thought that that kind of virus, which is the influenza family of viruses, that would be the one that emerged.
Thought it was going to be having to do with influenza, but it's like coronavirus and influenza are totally different. So it actually came from the coronavirus family, which we did not expect.
Exactly.
Okay.
Nailed it. All right, so this is after there's all this molecular laboratory research. So then we say, okay, here's something that could maybe work. And so then we have to go through a period of clinical trials. Okay, so clinical trials come in 3 phases, and whenever they are trying to find out if a vaccine might work, then they start with adults, and as you might imagine, the first one is called phase 1. And this is a small group, like 20 to 100 healthy volunteers, and they're really testing, is this vaccine candidate safe? Does it work? Are there any side effects? Okay, so that's a phase 1 trial. And then if the data that come out of that trial are positive, showing that it is safe and there are minimal side effects and it looks like it works, then it proceeds to a phase 2 trial. So then phase 2 clinical trials have several hundred volunteers, and they're looking at sort of, some of the same kinds of questions, safety, how this works. They're also looking at how the immune system responds. So does it actually give, an immune response that protects the person? Okay, and then phase 3 trials is hundreds to thousands of people.
Sorry, you're running out of space.
Yeah, I am. But it's asking the same kinds of questions. Safety, I'll just carry this on over into phase 3. Does it work? What's the immune response? And these are all the things that we try to learn whenever there's a phase 3 clinical trial. And all of that stuff needs to happen before we can have a vaccine that's ready to release to the public.
Is it possible to have vaccines for autoimmune diseases? Which are diseases that where the immune system attacks itself, right?
That's right.
Yeah.
I don't know of any vaccines for autoimmune diseases. There may be some. People can leave us comments if they know of that.
This next question is from my aunt. It's about Trump. Trump is mentioning medicine already in existence. Is there any merit to those claims, or are his pants on fire?
So that also kind of has 2 components. Are there medicines already in existence that are used to treat viruses? Yes, there are. There are lots of medicines that are being considered as potential treatments for COVID-19. And do we know if any of those medicines are effective treatments for COVID-19? No. So we really want to be careful about not believing claims that we have a treatment that works.
This next question was asked by my grandpa. The original phrasing we decided not to put in. And Grandpa, if you're watching this, you're the only one who knows how it was originally phrased, other than us. But the rephrase is, what do we need from leaders in a crisis like this?
We need them to tell the truth, even when the truth is hard to say out loud, and even when it's going to be hard for people to hear. And a few years ago, I was having a conversation with some friends of mine about leadership and communication and a good way to be communicating and what you need from people in leadership roles. Mm-hmm. And so a friend of mine mentioned 5 adjectives that really stuck in my mind about this. They are honest, compassionate, clarifying, gentle, and this isn't really an adjective, but timed correctly.
I think we also need people to be honest and compassionate and gentle too.
Yes, you're right.
Like, it's not very, I don't know, it's nobody's fault that this happened, so
That's right.
if we try and blame other people, there's really no point in this.
That's right. I totally agree.
This question is also from my aunt. What kind of social supports are necessary or recommended to maintain a mentally healthy society?
Well, I mean, I'm not a mental health specialist, but we know that social networks are important. We know that something called social support is important. People who have more connections can have better health outcomes. They have people that are close to them and people that they can contact. So obviously that makes this really hard. I mean, we're lucky because we have our family, our immediate family here in this house with us. But it's still even hard for us to be disconnected from our friends and our grandparents and all of those people. But luckily we have, the internet and even social media, which, I'm not always a great fan of you all looking at screens and whatnot. But that's okay.
This question is from my friend. How do you practice social distancing properly?
The first and most important thing is to stay home as much as you can. Really, there's actually really interesting evidence that if we keep small clusters of people contained, and if an infection comes into that cluster and it's contained within that cluster, it doesn't go outside the boundary of that small group, then that's the end of a transmission chain. So it can go from person to person, and then if it stops in a small cluster that remains socially distanced from others, that stops the spread.
Yeah, but a small cluster is not like your town. A small cluster is you and like your family, which is like 4 to 5 people.
Yeah, whoever lives where you live.
Yeah.
And that's it. And then if you absolutely must leave, you need to stay at least 6 feet apart from other people.
Now we're going to be debunking some myths. So one myth that I've been seeing and hearing about is that people, at least in the U.S. where we live, aren't going to Chinese restaurants or staying away from people who are perceived to have Chinese heritage because they're worried that that would make them more exposed to COVID-19. Is that true?
No. It's really dangerous when we start to use the fear that everybody feels and turn it into prejudice. And this virus is in our towns, it's in our states, it's in our neighborhoods, it's certainly in our country. It's now what they call community-based spread. So it's not connected to any given country or any given type of person or ethnic origin. It's here and it's spreading person to person. There is no basis at all to behave in a discriminatory or hateful way toward people who are perceived to have a connection to China because of this virus. There is no grounding in that at all.
It is also not anyone who's from China's fault that this happened.
That's right.
We cannot blame them.
That's right.
This was, as she said, this was going to happen. We knew it was going to happen. It doesn't matter where it came from. All that matters is that we do the right things to stop it.
Exactly.
Okay, the next one is, it's bad to take ibuprofen if you have COVID-19.
There is no evidence for that connection.
Right now. Could change. Okay. Taking a hot bath or being in a warmer climate protects you from getting coronavirus. That's the last.
So, again, this is something that we're hearing a lot, and I think it's, certainly a hope that as it gets warmer or being in a warmer place might protect you. There are a couple of pieces of information that have come out suggesting that it might help to be in a warmer or more humid place. There might be reduction in cases, but it's not definitive. It's too early. We can't say that. And even if that does turn out to be true, that data also suggests that it's not good enough to stop the spread. We need to be doing social distancing in order to stop the spread and flatten the curve.
Okay.
So what is flattening the curve and why does it matter?
You're asking.
So I'm saying that's what we're going to do here. So flattening the curve. Actually, the first thing we'll do is figure out what do we even mean by the curve. And what we mean is the epidemic curve. So when there's an epidemic, there's a period of increasing cases, there's a peak, and there's a period of decreasing cases. That's an epidemic. It breaks out, spreads, hits a high point, goes down. So the bottom axis is time, and it specifically is going to be days since first case. All right, so then that means that this time point at the beginning of this axis would be the first case. All right, and then this axis is number of cases. So the higher we are, the more cases. Okay, so this one is flatter. And that's the one we want. That's what we're when we are talking about flattening the curve, we're talking about moving toward this blue type of epidemic curve.
Mm-hmm.
Okay, so now let me talk just about why that's important. So what we'll do is we'll look at 3 time points kind of early on in the epidemic. So let's just pick. So these are, this line is days. So we'll say this day, and this day. All right. Okay, so on this day, if we are in the first epidemic curve, then the number of cases is here, right? So we have, fair few, and this is just a few days into the epidemic, and we're still in this low point of the curve. Then a few days later, we have a really drastic increase in the number of cases. Look at that. Just a few days later and so many more cases. That is potentially overwhelming to the healthcare system, because however many cases we have, you remember from before, 20% of them are severe. And severe cases need medical care, sometimes intensive medical care. And then look just a few days farther along. So this is, let's say we hit the peak. And then let's look. Whatever this axis is, we have gone way, way up it in a very, very short period of time. So there was a study that was done, a mathematical modeling study at Imperial College London, and they actually looked at the numbers that came out of China, and they tried to say, okay, what could this look like in Great Britain, and what could this look like in the United States? And essentially, if the epidemic curve looks like this reddish-orangish line, then it would overwhelm our hospital system many, many times over. Okay. Okay, so we're looking at now if it's more like a hill and less like a mountain. Mm-hmm. All right. And so we're going to go with the exact same time points. So this first day will be, here we go, up to this, now the blue epidemic curve. And I'll try to draw a straight line. And we have a low number of cases. But we know it's growing. This line's going up. Okay, but then at the same time point, a few days later, well, not the same time point. Same time point we looked at on the other curve, right? Let's see where we would be for number of cases. So remember the difference. This is just not that much of an increase. And we know, again, right, that 20% of these cases will be severe and need hospital care. This is a much more manageable increase. This dot, you remember, was the peak on the first curve. But here we come up to this second version, the flatter version, and we're still at a relatively low number of cases. And by relatively low, I mean compared to the first epidemic curve. So this is what we want. We want lower numbers of people infected altogether. We want lower numbers on any given day. We want the epidemic curve to be slowed down. So when we're flattening it, look at it, it takes much longer, which is, kind of a bummer. We'd like this to be over with. But if we flatten it and it's slower, then that means on any given day we have a smaller number of patients, and therefore, a smaller number of people infected, and therefore a smaller number of patients in the hospital, right? But it also gives us time to figure out how best to care for people who need it. This whole business here is social distancing is what makes the difference. There's really good evidence from the 1918 influenza outbreak and other studies that this social distancing has to happen early, and it needs to be sustained in order to keep the curve flat.
That's it for this extended cut. I don't really know. We don't have a name for this video, but I'm going to call it the extended cut. If you want to go see the other videos that we made, they'll be on our channel, up in the right corner, up there, and in the description if I remember to put them there. And if you have any questions, like we said in the other video, you can comment them or send them to our email that we're probably going to make maybe. And we'll probably, and we definitely have time to answer them. So if we get enough, we'll make another video. Bye!